First trimester miscarriage. Miscarriages happen most often in the first trimester, with many happening before 10 weeks gestation. For the most part, nothing can be done to prevent or stop these pregnancy losses. Causes. In most first trimester miscarriages, the embryo or fetus stops developing early on, often due to chromosomal or placental problems. In these cases, the woman's body will recognize that the pregnancy is no longer viable and begin to shed the uterine lining. This is the process that causes the telltale signs of miscarriage, namely cramping and vaginal bleeding. Symptoms. In some cases, the bleeding may be light, similar to a regular period. Other women may experience more subtle signs, such as the sudden loss of pregnancy symptoms like morning sickness or breast tenderness. In other instances, weeks may pass before any signs or symptoms appear. Confirmation and treatment. If pregnancy loss occurs during the first trimester, an ultrasound and/or blood tests may be used to confirm the diagnosis. Depending on the timing or cause, the woman may choose to complete the miscarriage naturally or seek assistance to speed up the process in the form of medications or a surgical procedure called dilation and curettage, D&C. Threatened miscarriage. In most miscarriages, the baby's heart will have stopped beating before the outward symptoms of miscarriage appear. However, in some cases, vaginal bleeding will occur when the heartbeat is still detectable and the cervix remains closed. This is called a threatened miscarriage. In many instances, the bleeding will stop and the pregnancy will remain viable. In others, the threatened miscarriage will end in a loss of the pregnancy. There is really no way to predict the outcome. While some doctors will recommend rest and the avoidance of sex, exercise, tampons, and heavy lifting, there is little evidence that these interventions help to preserve the pregnancy.